Good morning again.
We're up bright and early here in London so that we can match up with our very special guest who is in New Zealand, Auckland, New Zealand, which is a 13-hour time difference for us. So it's actually quite a late night for her. Welcome again for episode 2 with Lou James. Thanks, Lou.
Thank you, Reece and Helen. Lovely to be talking to you.
We really enjoyed our first episode with Lou. So if you haven't had a listen to that, go back and refresh yourself on that one. So we spoke about Lou's business, which is Pinc and Steel, which looks after treating and training therapists to treat people who have cancer or have survived cancer. And that conversation flowed into the importance of exercise for this population. And I'll just give you a hint, it's very, very important. Now we're going to continue the conversation now through episode 2, and we're going to look a bit more at, I guess, cancer itself and people's experience of cancer, and again continue the theme of the importance of exercise for this population. So again, thanks for being with us, Lou, and we'll jump straight into things. So Pinc and Steel, you train therapists to look after people during their cancer journey. What are some of the side effects that people may experience during cancer? And I know we spoke about different cancers having different side effects and things in the first episode, but what are some of the major ones that the training Pinc and Steel offers helps therapists to look after with people?
I think there's such a wide variety of side effects that from the cancer treatment that physiotherapists can help with. And so the side effects are caused by the cancer itself. They can be caused by the surgery, it can be caused by the chemotherapy, the radiotherapy, or the hormone treatment. So there's a very wide range of types of side effects that physiotherapists can help. But all of the treatments can either individually or collectively cause impairments in strength, impairments in balance, impairments in range of motion. So all those sorts of impairments are things that physiotherapists can address. Also, they can cause a lot of impairments in breathing and muscle weakness and deconditioning and mobility. So those are the kinds of things that as physiotherapists we can help people address. Often, obviously, when people have those impairments, they can also get things like pain, which can lead to chronic pain and those other problems. So a lot of the issues and the side effects that physios are treating are from the cancer treatment and the consequences that's then had on that person's body. So also the treatments, because as you know, have a systemic effect on the body. So they can affect people's physical endurance and they can affect their activity tolerance. And sometimes, simple functioning for everyday living is impacted. So, especially when people have a combination of treatments. And I think one of the, a really major thing that we also treat is fatigue. So, cancer-related fatigue is a real massive issue that so many people affected by cancer face, and it may not be something that they think they would get help from a physiotherapist with. But, our skills in terms of teaching people pacing, delegating energy, all those sorts of things, helping them understand how they can use their energy by exercise to gain more energy, and those sort of things are really important. So there is a huge wide range of side effects that physiotherapists can help with. And I want to give you one stat. The Macmillan Cancer Support in the UK, they have estimated that 70% of people diagnosed with cancer are struggling with physical side effects between 1 and 10 years after treatment. Wow. So this isn't just something that happens to people while their treatment is going. Some of these side effects occur after the treatment has been completed and they start to get worse. And so, that is a lot of people impacted by the side effects of cancer treatment. And so that even, as we as physiotherapists know, the consequences of reduced range of movement, reduced strength, problems with breathing, all those things can then cause other consequences. And so, I think the real important thing is if we can intervene early, then we can help stop some of the unnecessary suffering that people have and the unnecessary disability that people have.
So you mentioned there that it can be up to that kind of 10 years and more that people are sort of experiencing some of this stuff with. So how early can someone get involved in kind of the treatment programs, and what do Pinc and Steel kind of do in terms of those kind of key aspects of how people move around depending on what stage they're in?
How early can they do it? They can do it as soon as they are diagnosed. So there's been a lot of research now in the benefits of prehab. So if people have some understanding of how the cancer treatments may affect them, then they know what they should do, or they know who they should seek out with if things aren't going well. So prehab is really important, and it's used more and more now in prostate cancer and gynecological cancers and some breast cancers, even in lung cancer it's used. But it's, again, with COVID and with a lot of health organisations, sometimes it doesn't happen. But physios can be involved early on. If we can take baseline measures so we understand what normal is, then we can help people get back to that. So I think the earlier the better, Helen, and you can't be too early.
Lou, with the Pinc and Steel programs, how often are you getting people to? So how often are you seeing people say face to face, virtually in the current environment, and how much of it is involved with them going off and doing their own thing?
So it totally depends. So Reece, with the Pinc and Steel programs, we have physiotherapists that work within hospital settings and acute care. We have physiotherapists that work in outpatient settings, and then we have physiotherapists in private practice. We have physiotherapists in hospices. So it really depends on where they are seeing the people affected by cancer, exactly what the treatment's involved. But ideally what happens is that we start off and it's face-to-face, and they have a thorough assessment. And that's often for an hour. And that's so the person can download all their concerns, and we can do a full body musculoskeletal assessment. We can do a functional assessment. We can take outcome measures and get really good baseline, so we've got something to build on, and we can design a program that's going to help the person get back to the outcomes that are actually important to them. Yep. So that's what we do. And then it can either change so that we then see them during the clinic a little bit, or if you're in COVID, you would see them online on a weekly basis to help them, encourage them to keep going. What we really hope to do with Pinc and Steel is to then transition them into being able to do it on their own or into group support. Because what we found with people affected by cancer is that having that social support can be really, really great. When there are other people that are struggling with similar things and understand what you're going through, it can be very, very therapeutic and beneficial. And we find that often in the group classes that we do, people make friendships and bonds, which then help them, continue with lifestyle change and make good choices going on. And particularly with exercise, we find that really important. Like with our group stuff, often they'll end up continuing classes together or going off and doing walks together, or those sort of things. So we try and transition people into small group oncology classes. And then our goal is to actually transition them into the community. So get them out doing your Pilates classes that everyone else is doing them, or get them out cycling with the cycling team, or get them back playing golf. Our goal is to take them from wherever they come into us and actually help them get back into the community. Did that answer your question, Reece? I'm not sure if I did.
Yeah, no, absolutely. Right. Yeah, that's fantastic.
And that's your Next Steps and Paddle-On program, isn't it?
Yes.
So I'm really excited about this. So I'm either hoping borders open and I can come and do Paddle-On in New Zealand, or it's going to be a really interesting video experience. But can you talk a little bit more about your Next Steps and Paddle-On program? You kind of touched on it there.
Yeah, so we once I started working with people affected by cancer, I realised that they needed care for a longer period of time, and that group part was really an important part of it. So I think people need individualised care first, but I really do believe in the power of groups now as well. So our Next Steps program, I looked at all the latest research. Reece, I know you're interested in exercise, but in terms of exercise and the benefits it has to cancer patients. And as I have mentioned to you, the combination of exercises is important. The cardiovascular component, the resistance component, the flexibility and balance component, and the restorative and sort of relaxation component. So Next Steps combines them all in one class. So it has sort of yoga, warm up and stretching. It has some Pilates exercises and body weight exercises for resistance. It has we use a step. It is called Next Steps, and we use a step to do cardio. And we really try to get people to be able to get up to moderate intensity exercise. And we found the step is a great way of doing this. It's not an expensive piece of equipment. People have been using it in lockdown in the UK. They can buy their own step, and we can then because when you're working with a class of people affected by cancer, everyone has different abilities. So you can have people that have a higher step or no step, and you can change, they can change the intensity for different people within the class setting. So we use a step for a lot of the cardio component. And so, the Next Step tries to combine, all those types of exercises in our session. And when I first developed it, I was actually really overwhelmed with what the response that we had from it, and the evaluation that we had from people doing it, and the impact that it had on not only their physical capabilities, but their confidence in their physical capabilities, but also in their mental health as well. And that to me was so encouraging. People were saying that the classes were giving them more energy, making them feel less irritable, less depressed, they were sleeping better, they had less pain. A whole lot of things were coming from them doing the classes, which then made them want to be exercisers. So many people that join our Next Steps class want to keep stepping. So we've got some next steppers, but as I said, our goal is to actually get them into mainstream classes. And if they like the yoga component, they might do more of that, or if they like Pilates, they might do more of that. Or actually, a lot of our groups now, we encourage them to go off into the community and do an event. So a lot of the times, because they've got support of others, they might go and do a 5K walk together or a 10K walk together. And we actually just had a group that did that in New Zealand last weekend. They all got together after they'd done their classes, and they competed in either a 5 or a 10K walk together, which was so rewarding, because a lot of them had never done anything like that in the past, and that was super encouraging for them personally, but that also has a massive impact on everyone around them that loves them. When you see someone that's really struggling going through cancer and you're really worried about their health, and then they get through it and they come out of the Next Steps class and they want to go and do an event, you're thinking this person's doing pretty well. So that does have a really big impact on the people around them, which I think is a real bonus for us physios that are working in this field.
I don't have cancer, Lou, and it sounds like I'd enjoy the Next Step sessions, to be honest. It sounds great.
And then Paddle On's even more exciting. Well, Paddle On is where we get people on the water, and I didn't come from a background of paddling, but I got encouraged to try paddling from someone who wanted my support to help it with cancer survival. Are we talking
stand-up paddle or kayaking? What are we talking here?
Stand-up paddling. And I'd never done it, and honestly, the first time I stepped on it, I was like, oh, this is amazing. I could see from my Pilates training how my abs were working, and and how good it was for my posture and my balance. But number one thing, it's so nice to be outside on the water. It's the absolute
water's therapeutic, isn't it?
Yeah, and it's the absolute opposite from being, in a hospital bed, and it's just the therapeutic side of it, and the gaining this new skill that people, the way we teach the program, we focus on certain parts we divide it into modules. So we focus on balance, we focus on mobility, we focus on strength, we focus on fitness and those sort of things. And so each week they get better and better, and their confidence gains. And we have such great stories from our Paddle On program of people that were super scared to try it, didn't think they'd be able to do it, that fell in tons and tons of times to start with. then they got through it, and they just had so much confidence, and so many of them end up joining our paddling communities, which I think is just awesome, because they then have the support of other people. They get up early and they keep paddling. So I'm delighted with the response we've had to our paddle on program, and I would really like it to go to the UK.
Yes, I'm desperate to bring it down here.
It would have to be a summer, a small window in summer, but I'm sure it would be beneficial to get people out there, and it's just trying new things. Because I think one of the big things that cancer does is it takes people's confidence away. And when we can get them doing things like that and they see that they're capable, it gives them the belief they're capable of other things. And so, I'm not, it doesn't matter if they don't stay paddlers. If they then have the confidence to try something else or do other things physically, I think that's a real awesome win.
Absolutely. Where would we get them out, Helen, do you think? Out on the Thames?
We're going to come out onto the Thames. Yeah, if you come down kind of this way and you head out towards Sunbury and stuff, where we're filming some of the on-demand, in the summer the river's quite calm and it's not got too much flow and it's clean. So when you fall in, you're probably not going to catch other things or bodies, and so yeah, we'll kind of take it out there. I mean, it's beautiful down there, and I'm determined, because I love being outside, so I am absolutely determined to try and get that over in the UK. I have to learn to paddleboard first, but that's a different thing.
It's a classically Kiwi thing to get people outside doing like something a little bit extreme, so I love it. It's fantastic. Get them out on the paddle boards, and having tried it myself, you work pretty bloody hard on those paddle boards. So it's a good old workout. And as you say, being outside in the fresh air is certainly therapeutic as well. Lou, just getting back for therapists that may be seeing people with the cancer patients, how do you gauge how hard you're pushing people in a session? So say someone comes in for a strength session with me. Are you using RPE? Are you using heart rate? Like what sort of measures do you generally use in session?
Again, that can be very, very, very depending on what the equipment that you have and the work setting that you're in, and whether you're working with people during their treatment or after treatment. But I think one of the things with physiotherapists, if you're doing supervised exercise and you are right there, our observational skills are probably the most important thing, and checking in with the client for how hard to push them, because we can see if they're not coping with breathing, or they're coming short of breath, or they're going pale, or they're feeling faint, those sort of things. We need to give them a rest. But really, a lot of the time, I think we actually probably underestimate what people are capable of if we're in that supervised setting. It's quite different to sending people off where you can't see them and prescribing things. When you're in that supervised setting, I think that you can push people probably harder than what you think you can. But our observational skills, but yes, you can use heart rate monitors, you can use those things, but I don't think they're 100% necessary. You can gauge a lot from being right there and supervising a patient.
So would you say to therapists, don't be scared to push these people a little bit?
Oh, sorry, you cut out for a minute there, Reece. Can you repeat that?
Would you say to therapists that don't be scared to push this population a little bit? You don't have to pander and wrap them up in cotton wool. They can be pushed.
Absolutely, yeah, absolutely. And I think a lot of the times they are wrapped up in cotton wool by their family members, and they're lacking in confidence in themselves and from other medical professionals. So definitely you can push them, but you do need to make sure that they are at higher risk of cardiovascular disease. There is some adverse effects. And I do recommend that physiotherapists that want to get into this field do some training so they understand and feel confident, because if you're confident in what you're doing, then you'll give the people that you're working with confidence. So they are medically complex group, but we can push them. And I had an experience recently where I worked with a whole lot of canteen people. So I'm not sure what you call them in the UK, but young people affected by cancer. So between the ages of 13 and 23. And we did a camp, and it was my role to get them excited about exercise. And, you know, teenagers that are very fatigued, and getting them excited about exercise. I've got my own teenagers. I was like, oh, I'm going to have my work cut out for me. But we did a lot of physical testing, and then we you know, we gave them a lot of help and support, and did the exercises with them. And I think one of the things, and we did a whole lot of activities with them actually, and we did take them paddleboarding. But one of the things that I really noticed was whenever we were going to do something, so many of the group ran up to me and said, Lou, is it okay if I do this? Am I allowed to do this? You know, because their whole, and, you know, a lot of these people had cancer 6 years ago. You know, and they were just unsure whether anything was safe. And so I do think we really have to be confident that most people, you know, can exercise and can push themselves. It's okay to get breathless. It's okay to get fatigued. We can sit down and we can relax, and we can get our breathing back down. You know, those sort of things are okay. So, yeah, I hope I answered your question there, Reece.
Absolutely, yeah.
Yeah, and you touched on it there about the importance of training. And, you know, as physios, we see a lot of people coming through the door with a lot of different problems, but kind of doing that first 12-week program, there was so much stuff in there that I had never even contemplated, never even thought about, the treatments that people are undergoing, the medication that people are taking, you know, all of that side of stuff. There is so much that you need to be aware of and have a degree of understanding on. And I think that is really important. So if you are doing or seeing more and more of these people, I think, you know, it's really important to undergo some of that training, just because you don't know how much you don't know, and I now know how much I really didn't know.
That's the life of a physio, isn't it? Just constantly realizing how much stuff you do not know. Lou, what's one of your favorite stories or inspiring stories of someone that you've worked with and have achieved a lot? Is there any that sort of come to mind?
That's quite a hard question, Reece, because there's so many different stories that inspire me. And I think people are affected in such different ways, and seeing their courage and seeing their grit and determination and positivity a lot of the time. Sometimes I'm just gobsmacked with how positive they are with what they're dealing with. But I mean, one of my favorite personal stories was that I was working with a lady who was diagnosed with cancer when she was training to do a half marathon. She'd never run a half marathon. She was never interested really in running, and she was training for a half marathon, and then she got diagnosed with cancer. And so when she saw me, she was really down, and she was really wanting me to be optimistic that, you know, she was going to get back to do this. And I didn't want to you know, give her any false hope, but I worked with her, and once she had completed her treatment, I had the opportunity to go to China to run the Great Wall of China Marathon. So I asked her if she wanted to come with me. I thought she was just going to say no, Reece. I thought she was just going to go, no, you crazy. And so I asked her, but I actually had a backup plan, because I thought she's probably going to say no. So I also asked someone else who I'd helped. And again, she wasn't a runner, but I said, you know what, why, you know, would you come into the Great Wall of China with me? Surprise, surprise, they both said yes. So it was, I helped them in their training, and it was so awesome. They were both, you know, weren't runners and had never done anything like that, and were, you know, it was hard. Training is hard, and they had fatigue and they had issues that they had to overcome. But we all flew off to China, and we all got to the start line together, and they did the half marathon in China, which is probably one of the hardest half marathons in the world you can do. 3,000 steps. It's really humid. You know, the accommodation isn't plush. But anyway, I dragged these women over the wall. I did the full marathon. And while I was doing the marathon, my heart did sink a few times. I was thinking, have I pushed them too far? But one of the things that we also did is when I asked them to do it, I said, I really want more people to understand the importance of exercises for people affected by cancer, and let's raise some money while we do it. So they had got so much donations in the lead up to it. So before the start line, they all felt, oh my goodness, we have to do this. There's so many people that have put money into us and are backing us. So anyway, we all completed the race. We raised $20,000 for cancer rehab together. But for me, the highlight was I've done events before and I know the buzz and I've had that buzz. But to see these women finish something like that and the buzz they got out of it, the confidence they got out of it, they could have not done that before they had cancer. So they were just feeling so amazing, and everyone around them felt so, was so appreciative of what they'd gone through and how they'd got there. So to me, that's just one of the stories that I find really inspiring. I mean, and I don't think everyone needs to run a marathon, but it was really cool to be on that journey with those women.
Yeah, there's some great messages in that story, I think, Lou. It's absolutely amazing.
I don't think we can go on after that.
No, well, I guess the last thing to sort of finish off, Lou, is if people are wanting to access the training that you offer, the Pinc and Steel training, how do they best go about that?
So we have an application process on our website. So they just need to go to pincandsteel.com. There's two sides to our website. There's a patient side, which helps to direct patients to therapists in their regions, in their community. And the other side is for physiotherapists who want to do training, or for our physiotherapists, we have our resources section and things to help keep supporting them in this work. So they just need to go on there and see the courses that are available and apply online, and I'll be in touch with them. But I think it's a really great field for physiotherapists to be involved in. It's a very important field, and I think it's great when physios also have the confidence to get out of their clinics and do things with patients outside the clinic walls as well. So I'm all for, really getting involved in the practical elements of helping people affected by cancer live well.
Absolutely. Lou, last thing, if people want to contact you, is the website the best place to do that?
Yeah, definitely. You can contact me via the website or my email address, which is lou@pincandsteel.com.
Fantastic.
Amazing.
Well, Lou, I can't thank you enough for giving up your time for us this evening for you, this morning for us here in the UK. Certainly some fantastic messages for patients and therapists as well, I think, in the last couple of episodes that we've just done with you. So I can't thank you enough.
Thank you so much, Lou. And for anyone contemplating doing the training, I would highly and strongly recommend it. It was challenging and quite tough, but it was also an awful lot of fun.
Awesome. Thank you, guys. It's so nice to talk to you. I hope I get to travel to the UK to actually see you in person at some stage in the near future. I'll definitely be coming over when I can. So hopefully I get to see you then. But you are all welcome to New Zealand. Hopefully.
I'm taking you up on that one.
Yeah. All right. Well, I will finish by saying kia ora, Lou, and hopefully see you in person soon.
See you.
Thanks, Lou.
Bye.
Bye.